Hi there, and welcome back to Dr. C's Morning Minute. We have been talking about self-stimulatory behaviors and really focusing on the sensory aspects of these behaviors. And one of the things I don't want to leave out in terms of causation, in terms of things that contribute or worsen these tendencies, is the medical complications. And so if a kiddo is having struggles with gastrointestinal problems, stomach pains, constipation, headaches, fevers, things of that nature, pains of any sort, oftentimes that will clearly, unquestionably, worsen the experience and the observations then of self-stimulatory behaviors. Now, the real challenge with that we often face is that kiddos who have issues with language, they can't tell you what their problem is, or they don't necessarily, even if they do have some language, they don't necessarily make a connection between a particular pain or whatever to their behaviors, or they're not compelled for whatever reason to share that they have a particular ailment. And so we are left with surmising, and that's why tracking behaviors is so vitally important. As labor intensive and as challenging as it might be, keeping diaries and logs concerning behaviors and aspects of any given day can be really important. Even if we just do it for segments of time, a few weeks at a time, you take a break, because oftentimes these behaviors are repetitive, but it helps us understand and get a sense of patterns, where over the course of the past 2 months, whenever there was an increase in stims, at the same time we noticed that that if we treated headaches or stomach pains, and we noticed that there was increased constipation during that time, whatever the case may be, we can make those correlations. That can be really helpful. So again, medical complications, and I should touch base as well as the idea that tracking behaviors in general helps tremendously for us to get a better sense of just what's going on with any given child, whether it be medical, whether it be a particular task at hand is then causing an increase in stims. We notice that over the course of time. We notice certain, again, patterns of behavior that without a log, without a diary, we may have missed. And so that's why tracking is so important. But again, we don't want to disregard medical complications that can worsen stims, and we can make those connections as well. Okay, so that's another aspect. And again, medical issues do have a sensory component to them. So again, the sensory elements of stims is vital for us to track and take note of, and then and to treat, of course, the medical complication, and that then reduces the stims. All right, and also, of course, makes our kid feel better, which is the most important aspect of all of this. All right, so see you next time, Dr. C's Morning Minute.